If you or someone you know lives with diabetes, the first few hours after waking up can be revealing. Your body may give you early warning signs that your blood sugar isn't quite right. There are some sneaky symptoms that can show up in the morning, signs that are easy to overlook but can make a big difference in how your day and your health unfold. Today, we're diving into 7 dangerous morning diabetes signs you should watch out for. You might be surprised by the first one. Let's get started with number 7. Morning hyperglycemia, also known as the dawn phenomenon. Imagine waking up feeling groggy, thirsty, or even a bit nauseous. You might just blame it on a rough night's sleep, but for people with diabetes, it could be something more. Here's what's happening. Your body reacts to a natural surge in hormones, like cortisol and adrenaline. These hormones prompt your liver to release extra glucose to help you get ready for the day. For most people, that's not an issue. But for those with diabetes, this extra glucose can cause blood sugar to spike. The dawn phenomenon usually hits in the early morning, and it can be stronger if your diabetes isn't well managed or if your medication wears off overnight. Here's a quick tip. Check your blood sugar when you wake up. If needed, talk to your healthcare provider about adjusting your medication or insulin. A balanced bedtime snack with protein and fiber can help keep your blood sugar stable overnight. Moving on to number 6, dry mouth and excessive thirst. If you wake up feeling like you've just crossed a desert, it's not just typical morning thirst. It could be a sign that your blood sugar was too high overnight. When glucose levels are out of control, your body works overtime to flush out the extra sugar through urine, causing frequent urination and dehydration. This is why you wake up so thirsty. If you find yourself regularly reaching for a drink when you wake up, check your blood sugar and stay hydrated. Next up, number 5, blurred vision. If your vision is a little fuzzy when you wake up, it could be a result of high blood sugar. High glucose can cause the lenses in your eyes to swell, making it harder to see clearly. This happens because glucose draws fluid into the lenses, causing blurry vision. It can happen at any time, but it's often more noticeable in the morning, especially after a night of high blood sugar. If blurry vision becomes a common morning occurrence, it's time to check your glucose levels and take action. To protect your vision, quit smoking if you do, as it can worsen damage to the blood vessels in your eyes. Wear sunglasses to protect from UV rays, which can speed up cataract development, a common diabetes complication. Number 4, morning headaches. Waking up with a headache can be a sign of blood sugar problems. If your blood sugar drops too low overnight, it may cause a headache. Or if your blood sugar spikes, it can have the same effect. Managing blood sugar levels and staying hydrated can help prevent these headaches. Stick to a consistent sleep schedule and try to avoid too much caffeine or alcohol, especially before bed. Both can disrupt your sleep and trigger headaches. Also, managing stress is crucial. Stress can affect your blood sugar and lead to tension headaches. Try stress relief techniques like deep breathing or light stretching before bed. Now, on to number 3, morning fatigue. You've had a full night's sleep but still wake up feeling drained. What's going on? If your blood sugar is too high, your body struggles to turn that sugar into energy. So instead of feeling refreshed, you feel exhausted. If this fatigue happens frequently, it could be a sign that your diabetes is not well controlled. The tiredness might follow you throughout the day, leaving you low on energy. Monitor your blood sugar and talk to your doctor if this is happening often. They may need to adjust your treatment plan. Next, number 2, tingling or numbness. This is a classic symptom of diabetic neuropathy, nerve damage caused by high blood sugar. It often starts in the hands and feet and can cause strange sensations like tingling, numbness, or pain. These symptoms can happen at any time but are often worse in the morning. After lying still all night, damaged nerves can act up, causing discomfort. If you experience this frequently, get it checked. Neuropathy can lead to severe complications, such as infections or even amputation if untreated. Finally, number 1, morning nausea. Feeling nauseous when you wake up could be a sign of diabetic ketoacidosis, DKA, a serious condition that occurs when your body burns fat instead of glucose for energy, producing ketones that make you sick. DKA is more common in type 1 diabetes, but can happen with type 2 if blood sugar remains uncontrolled for too long. Symptoms include nausea, vomiting, and confusion, and in severe cases, even a coma. If you're waking up nauseous regularly, don't ignore it. Talk to a healthcare professional immediately. Remember, these symptoms aren't just signs of a rough morning. They might be warning you that your diabetes is out of control. Morning is your body's reset time. If it's sending you these signals, don't ignore them. If you or someone you love notices these signs, don't wait. Talk to your healthcare team to adjust your diabetes management plan. If you found this video helpful, hit that subscribe button and share it with someone who might need to hear this. Thanks for watching.